Anyway, this is our first President's Chat, and now we are hoping to get it live on International Women's Day, so on the 8th of March 2023. And we are so excited to have you as our first guest, as we have you so high on the wish list to come and speak to us. But Melbourne, Brisbane is a little bit far away, and especially as we enjoy our in-person meetings so much now, we try to have as little Zooming as possible. So this is a good in-between. And
as possible. Yeah.
Now you're a true role model.
Yeah,
In
definitely.
many ways. You're a female surgeon. You're originally from Bosnia. You have been awarded the 2022 Victorian Junior Doctor of the Year. Congratulations. And
Thank you so much.
you have done a very important survey of Australian and New Zealand medical parents and their experience into infertility, pregnancy, and parenthood. And I was hoping you could tell us a bit more about yourself and about your survey.
Yeah, absolutely. Thank you very much, Ira, for having me today and essentially raising awareness of this important survey and just advocating for our medical parents. So my name is Jasmina. I'm a breast cancer fellow at Peter Mac at the moment, and my aim is to subspecialize and do breast cancer surgery. So I'm also a mum to a 2-year-old Sophia. And when I was pregnant, I went through a phase of, experiencing life as a pregnancy registrar, and which had its ups they cope in terms of breastfeeding when they returned from maternity leave. So we had absolutely no insight of what women were experiencing when they were pregnant or when they were coming back to work after a parental leave. So I joined a medical mums Facebook group and found that almost every medical mum, there were almost 12,000 medical mums on this group, were sharing and experiencing similar stories. And I really wanted to capture that and share it with the wider audience in Australia and New Zealand, just to show the extent of the difficulties that women in medicine face. So I designed a survey, and the survey was based on an American survey, which found very similar results that we found in Australia. And it looked at the infertility rates of medical parents. It looked at the experiences during pregnancy in both registrar sort of years, but also in consultant years. And then it looked at the accessibility to parental leave and breastfeeding when they return back to work. And I was able to share some important data from that.
And can you tell us a bit more about this this important data? What did you
Yeah,
find?
so we surveyed a large amount of doctors. So over 1,000 doctors participated in our study. And I think at that time, it was the first time that the women and a few men were able to express what they were going through and able to share some of the ups and downs. So I think that's why it was such a successful survey in terms of the sample size. What the main findings in our survey was that women were delaying their pregnancy or parenting because of work-related factors. And when I talk about work-related factors, they were delaying because they felt that the system didn't support them to become pregnant. And so they felt if they delayed it later in their consultant years, they might have more flexibility to start their families. So on average, the Australian and New Zealand medical mum would fall pregnant at the age of about 32.4. And this was higher in those who were in a surgical stream, where they were almost 34 years old at the time of the first child's birth. So, and then when you compare that to the Australian population, the average age is 29. So it's quite a significant difference in terms of, the timing. And we found that there is a significant difference between the medical mums, the surgical mums, and the GP mums as well. The GP parents, medical mums, were more likely to have their kids earlier However, they had very little access to parental leave, so they experienced different forms of struggles in that regard. The other problems that we identify in the study is that the infertility rate was 37%, and there was 27% of medical mums who were resorting to IVF. And again, we put that in factors. More alarming was the fact that almost half of our medical parents experienced pregnancy complications. And they ranged from, and this is what the women were describing in their open text, it ranged from stillbirth to miscarriage to post sort of operative or post caesarean complications. And they were quite high, 50% had experienced such a complication. And to me, that was quite shocking because I really didn't expect it to be that high in a medical group where we're so aware and advocate for all our patients, but yet we experience such a difficulty. And I think on top of that, not sure if you can hear me there, Ira, but
yeah, I can hear you now. I think it was just
yeah, lovely. Yeah, it's just frozen a little bit. But I was just also going to add that the other finding that we made was that 1 in 3 medical mums also had a miscarriage, which is again higher than the average population in Australia. And we don't know what it's causing. We don't have any further data to look into that, but it's quite alarming. It's quite high, and it's important that we have this conversation and share the findings.
Yeah, that is shocking indeed. What are your plans for the future to do with these findings?
Yeah, so I recently, along with my group, published another article in the ANZ Journal of Surgery, and we put down sort of key factors that we think need to change in order to improve these statistics. And the way we came up with this is not only from what we were seeing in the survey, but also what the women were sharing with us. We received over 800 responses in terms of what they felt was important to change in the system so that we can improve the statistics that we've identified. So the most important, I feel, is we need to introduce a flexible training model or a flexible scheme across all hospitals so that women have access to part-time training or less than full-time training. Mm-hmm. At the moment, it's very scarce throughout Victoria, and I know throughout other states, and it's only if it's requested, and then even if that part-time was requested, at times you have to find someone else to job share that. So it creates it decreases opportunities for women to, one, pursue parenthood, but two, provide that flexibility to juggle the parenting and the full-time work. So I think that's very important that we have that, and it will create a sense of acceptance that it's okay to have part-time training, because I know at times it can be seen as a taboo to do the part-time training because suddenly you're deemed as not as interested in your work or committed. But in actual fact, data has shown that part-time training is equally competent producing, if not even more, because it creates a lot of non-operative or non-technical competencies.
Exactly.
The other, what we've identified, the other important factor is recognition of parental leave. So what we have at the moment is if a woman leaves the workforce for childcaring, depending on the amount of time that she's gone out of the workforce, that time is essentially gone. And often the women are seen as invisible during the time, and they're penalized by the system for not participating in the childcaring. So what we recommended is that parental leave is recognized in a CV model like defense leave or country rotation leave, so that if a woman has to take time off to provide care to their child, then that can be recognized in forms or points. And that opens the opportunity for men to also increase the parenting opportunities as well. It creates an equal playing field.
Definitely. We also know that it's much better for the child as well, and the development. And yeah, so I think these are very important
Yes, absolutely.
ideas that you have. We would love to include the links to those articles. I will ask you for them so we can include them. Are
Yeah.
they freely accessible?
Yes, I can definitely send you. The first article is freely accessible online. The other one, I will send you a PDF version of it. You can I'll link it to that.
Okay.
No problem.
Yeah, that's great. Yes. And did you find, because here in Queensland, we've had the discussion about freezing of eggs and in that way postpone pregnancies. Is that something that you found in your research as well?
We didn't ask specifically how many women went into fertility preservation. And that's certainly something that needs to be captured, I think. I know talking to other women, more and more surgical registrars in particular are resorting to freezing their eggs or some form of fertility preservation. And I think the reason why it's increasing is because they're now recognizing that training, whether it's medical or surgical, is taking longer than it did before. It takes a long time to get an accredited training position. And then during that time, it's demanding. Often there's no part-time training. And so women feel that they really have to take control of their fertility and then resort to this. What I've found is when talking to the women is that it is quite a difficult task when they go through the fertility preservation process. They have to take time off, and often that time is not paid for, and some experience some complications. And I think it's very important that we have an open discussion about this. And in our article, we actually call for fertility preservation leave so that women are paid for this leave and that it's recognized by the system that it's necessary.
Yeah. Yeah, definitely. I cannot agree more. Yeah. And now you have all these important findings. What are you planning for the future?
Yeah, so what we did at our hospital, where we ran this study at the Northern Hospital, is that we organized a mentorship program. So we buddied up surgical trainees or any doctor for the matter, a junior doctor, with a senior doctor who has special interest in counseling or guiding junior doctors in terms of, family planning, when is the right time. And so just providing that the feedback and advice on how to navigate parenthood and full-time or part-time training. So I think it's very important that we have mentorship, and that should be really started in almost every hospital. Other than that, my other plans is continuing as much research as I can in this area. So I'm working with my colleagues on, further expanding this and looking at, particularly in the surgical community, how we can incorporate this into the position statements so that for example, the College of Surgeons can use it and provide a mainstream acceptance of, for example, the fertility preservation leave. So that's still in the works, but it's a process in the making.
Yeah, I think that will keep you busy, especially if you're
Yes,
also
very.
being a surgeon. And
That's right.
And I really hope that not just the Queensland Medical Women's Society, but also the other medical women's society and the Australian Federation of Medical Women will be in touch with you as well and see if we can work together and be able to share more and help you with your further research as well in this.
Yeah, thanks very much, Ira. I think it's definitely important that we continue talking about this and raising the awareness. Even if it's simple things like for breastfeeding facilities, for example, there are many hospitals that still don't have allocated staffing breastfeeding room. So, if I can encourage the listeners or anyone who's interested in this area to, if they identify something like that, like an issue, to write to the medical workforce, to write to the CEO of the hospital, and just encourage them to make this available. Because I think on one hand, it's very important that we have research and advocacy, but it's really also every person or every doctor can make a difference in their own hospital by just advocating for the staff.
Yeah, definitely. Here at the Queensland Medical Women's Society, we also have a lot of medical students as members, and it might also be good to see if we can increase the awareness also with our medical students.
Yeah, absolutely. That's very important. I've been lucky enough to be invited to talk at the RACS ASC in Adelaide but particularly this issue and how we can improve what we have at the moment based on the sustainability model. How can we sustain this current workforce based on what's the workforce that is coming through? And I think medical students in that regard are very important, that we share this with them and that we encourage them to pursue whatever they may want to pursue, parenting and their career, but make the system so that it supports them. So I think it's very important that we include the medical student in this.
Yeah. Well, I couldn't agree more. I think...
Ira, I've been also...
Oh, yeah?
I was going to say, I've been invited to talk to the University of Melbourne medical students. So I'm hoping, wherever I go, I can share these findings and just encourage more, discussions and just raising the awareness. So hoping into making it better for the medical students that come through.
Yeah, definitely. Well, we will definitely do our part here at the Queensland Medical Women's Society and spread the word and the awareness. And if people would like to contact you, is there a specific way where they can?
Yeah, absolutely. So I've got social media, so they can find me on Twitter, which is at Dr Jasmina. Otherwise, I'm on Instagram as well as Dr Jasmina Kevric, and they can get in touch with me via my email, which is kevricj@gmail.com. And I love, I've received a lot of emails from doctors and medical students, and it's quite nice to hear their stories and what they're going through, but also feeling like I can use this research and help them, and it's very rewarding for me.
Oh, thank you so much. I think you're doing amazing work. Very important. I'm really sorry that the connection is not too good, but I could hear your message loud and clear. So that is what we will be having on our website. And I really look forward to seeing you in person again. We briefly saw each other at the Australian Doctors Health Conference, but I'm sure we will meet again in the future.
Yeah, it was lovely to meet you, Ira, and it was lovely to talk to you today. And I'm sure we will meet again.
I'm sure as well. And as a thank you, we will do a donation at UNICEF on behalf for the Turkey and Syria earthquake. And so thank you very much. And we will do that donation for you.
Lovely. Thank you so much. I think that's such an important cause. Thank you for that, Ira. Beautiful.
Okay. Thank you very much. I won't keep you from your work much longer, and I look forward to next time.
Me too, right? You can see I'm in my scrub, so I better head off back to work. But it was lovely talking to you. Thank you for having me.
Okay, and you. Okay, bye.
Bye.